Assalamu alaikum wa rahmatullahi wa barakatuh, and good evening and welcome to Vantage Point this evening. Being the month of November, it is a pulmonary hypertension awareness month, a very big name for a disease. Inshallah, we will be unpacking what pulmonary hypertension is all about. And to speak about pulmonary hypertension, also known as PH, the shorter version or shorter term to many viewers out there, we have been trying to create awareness of this disease for the past 2 or 3 years. And alhamdulillah, we are blessed in studio this evening to be joined by somebody who is specializing in pulmonary hypertension, and that is Dr. Steve Ponde, who is a pediatric pulmonologist or a pulmonologist, and inshallah we will be unpacking this disease tonight here on Vantage Point. We say a good evening to you, Dr. Ponde.
Assalamu alaikum. Good evening.
Thank you for joining us. Before we go on to what is pulmonary hypertension all about, just give us in a minute a brief history of your background.
Great. Thank you so much for having me, Zahir. 52 years packed into 1 minute.
Yes.
Not very easy to do, but as I said, I'm 52 now. Born in Zimbabwe and still proudly Zimbabwean, but I've lived and worked in South Africa for the last 26 years. I trained in Zimbabwe at WITS, and then I went on to Canada to study respiratory medicine in children. I currently work in the intensive care unit at Busamed here in Modderfontein, and I also run an outpatient pediatric practice. Father of 3, who hopefully, as God wills, will be doctors too.
Hopefully.
Great.
But when we look at the disease, pulmonary hypertension, before we unpack it, we know here on ITV we have featured Humaira Bodania, who is suffering currently from pulmonary hypertension, and we have tried to create that awareness. You are her doctor, you have been treating her for from the start of this disease. So when we want to unpack pulmonary hypertension, when people hear such a long word, they sometimes get confused to what this disease is all about.
Yes.
In layman's term, can you explain to our viewers what PH is all about?
Yes. Our viewers will remember that hypertension is high blood pressure. Now, we often think of high blood pressure as affecting the systemic circulation, so our arteries, for example. This, as the name says, pulmonary hypertension is high blood pressure in the vessels of the lung. And this is a very, very sinister condition, unfortunately. Something that we are unable to cure at the moment, but we manage with great difficulty. And I'm really glad that you have raised the awareness in the public about this condition, because early diagnosis is vital. You can get a better outcome if you treat these patients, who are usually children or young adults, aggressively from the very beginning. There are many causes for this condition. Most of them are secondary to another condition. For example, there are autoimmune diseases which cause inflammation of the vessels of the lung, and the lung blood vessels then constrict, become smaller, and pressure goes up in the blood vessels. But those you generally have to diagnose on the basis of other conditions that come out. Our listeners may know about lupus, for example, and other autoimmune conditions that can be associated with pulmonary hypertension. There is another which is related to blood vessels, where there's too much blood flow into the lungs. The one that most people remember is a hole in the heart, where there's too much blood flowing into the lungs. Those blood vessels get injured and you get pulmonary hypertension. But generally, the presentation is what we should really be looking at and be careful as parents and as patients to recognize the signs early so that you can present that to your doctor in time. Yes.
When we're looking at, you've just made mention of blood going through the lungs. Most of the viewers out there, I mean, generally when we hear medical conditions, when we say the heart generally pumps the blood. So if you were to paint a picture for our viewers out there, just explaining to us that the heart then the blood goes into the heart, comes out of the heart, then via the lungs. But now when you're talking about hypertension, is the arteries then getting too thick for the blood to flow through?
Very much so. Very, very much so. If our listeners would remember, let's say they are a little blood vessel, which is in my foot, for example. It would travel up the veins all the way into the right side of the heart. Now, the right side of the heart is really a receiving chamber. Below that, it really pushes blood very, very gently. This is a low pressure system. Since our lungs are very much like a very big soft balloon, they open very easily. So the pressure needed to push blood there is very low. So sort of about 15 millimeters of mercury. Remember, there's this blood pressure elsewhere is about 140 or so. So this is a very low pressure system. And it also means that the right ventricle is not used to working hard. It's pushing blood into a very free, low pressure system. So any rise in blood pressure in the lungs, from whatever reason, a big consequence is that the right side of your heart starts to fail. And you start to get swelling of the feet, your liver gets congested and it's sore, and you start getting distension of the neck veins and tiredness and weakness, and it really is a very serious condition. But back to the blood vessels in the lungs, if these are injured in any way, or there's too much blood flowing through them, they tend to become injured themselves, and they form scar tissue inside the blood vessel. So they become progressively smaller and smaller and smaller. Blood then takes a longer time to flow into the lungs. There is less blood flowing into the lungs, and acquisition of oxygen is therefore impaired. Now, this becomes the major problem in pulmonary hypertension, not being able to get enough oxygen into your blood.
You made a mention of it earlier that it is all about early detection and early signs and symptoms. So the viewers out there, not to go into a shock or a panic, but when we're looking at children, for example, what are then the early signs and symptoms of pulmonary hypertension? And also we know that it is a rare disease. We must make mention of this. It's not going to affect the populace, but there are certain times wherein a child will be affected with it.
I think it's a very good question, because the presentation of pulmonary hypertension is with fairly common symptoms. So, as you said, the majority of people who get these symptoms do not have pulmonary hypertension at all. But the hallmark is that because there is lack of oxygen in the blood, kids get very fatigued, they get tired. The tiredness is beyond what kids have if they have been playing outside and they come in and they are huffing and puffing. These are children who get genuinely fatigued, even with minimal exertion. So you find that if they take one flight of stairs, for example, they are panting and, asking for a break.
I'm still doing that nowadays.
You still are doing that despite all the healthy lifestyle you lead. But the thing is, the thing about pulmonary hypertension is how progressive it is and how severe the shortness of breath and the fatigue is. It often, when you look back on patients who have had this diagnosed, one of the main things parents say is, we did notice that he didn't like exercise like everybody else. When he exercised, he would get tired. And sometimes you find that you already have signs of cardiac failure. The swelling of the feet, the swelling of the liver getting pain, puffy eyes. They also have a lot of shortness of breath and tiredness without as much cough as you would expect for many common things. Asthma, for example, may make you tired, but it will certainly make you cough.
Okay.
So these symptoms of pulmonary hypertension can be subtle. The important point is take it to your doctor. Even if it sounds as if it's trivial, take it to your doctor and let the doctor decide.
And I've been reading about it where it's been commonly misdiagnosed as asthma. Is this what you are trying to get at? That
Yes.
Generally people then say, no, our child is suffering from shortness of breath, so it must be an asthmatic condition. They go to a GP, and then could a GP then misdiagnose it? Or is this something that when children are suffering over a long time of period, you've noticed it for 3 or 4 times, that no, go to a specialist?
This is a very serious problem with all rare diseases, because the symptoms are hidden in this multitude of other conditions that mimic it. So if a child goes with shortness of breath to a doctor, Generally, it's one of the more common things like asthma or bronchiolitis or a chest infection. So for a doctor to think about pulmonary hypertension as a possibility, you do have to tease out almost all the other common diseases and pull them aside until pulmonary hypertension becomes a big possibility. And here doctors should be looking at the severity of the shortness of breath. It's very, very striking. Secondly, the fact that these children don't show many other signs. They may not have the wheezy chest and the response to treatment that you expect. But also, I think what parents should do is never to take one doctor's opinion. Yes. This is with respect to all my colleagues. But we do, for rare conditions, we may miss the diagnosis. And the best way to get this done is to go back to the same doctor, say, doctor, you know, what you did for me, the investigations you did have all come back negative. I am still worried. It's a major issue. Our patients should learn to go back to their doctors, speak to them, and say, this hasn't worked.
But then how does a doctor or pulmonologist identify that the person is suffering from pulmonary hypertension?
Yes. Being such a rare condition, we generally restrict the diagnosis to people who have done this before. We have certain centers in South Africa which have been identified, putting together the experts to make the diagnosis. Essentially, we want to show that the pressure in the lungs is high, that it's consistently high, and we then test to see what the causes may be and what the response to medication is. So the team that is the pulmonary hypertension team will generally have a pediatric cardiologist. These are the specialists who have specialized in children's heart diseases, and they form the mainstay of our treatment team. The pediatric pulmonologist gets involved primarily to look at lung diseases that could cause pulmonary hypertension. They also do the intensive care if our little ones need to come into hospital with severe attacks. But we bring in many other experts to help with the diagnosis. We may involve the ear, nose, and throat doctors because ENT conditions can affect the lungs. We involve any other expert we can get to plump up this team and get better outcomes for our patients.
We'll leave it for now. Dr. Steve, you can catch your breath for a while.
Yes.
We go for a short break, and when we come back, inshallah, after the break, we will continue our discussion about pulmonary hypertension. Doctor made mention about some of the treatments. We're going to touch upon the treatment of it, awareness of this campaign and the disease as well. Stay tuned. We'll be back with Vantage Point after this short break. Assalamu alaikum warahmatullahi wabarakatuh, and welcome back to Vantage Point, where this evening we are turning our focus to a disease that has been in South Africa for a while, but more attention and awareness has been created about this disease, and inshallah it will benefit all the viewers out there. A disease called pulmonary hypertension, aka PH. Before the break, Dr. Steve Ponde, who is a pulmonologist and specializes and deals with children affected with pulmonary hypertension, spoke to us about this disease, the signs, the symptoms, and when we should be going to a doctor to diagnose it as well. And then briefly we spoke about the medication and treatment aspect of it before the break, Doctor. When we look at the treatment aspect of pulmonary hypertension, in the first half of the interview you made mention there is not a cure out as yet.
Yes.
So how do you go about treating such a disease?
So here, we know that treating any condition involves treating the underlying pathology, the underlying disease. And as I said earlier, pulmonary hypertension can be the result of certain conditions like autoimmune disease, like cardiac conditions where there's too much blood flow into the lungs. But there's a huge amount of PAH that we as yet don't know what causes it. And hopefully with a lot of research, we are going to know the reasons and be able to design treatments for it. But for now, treat the underlying condition if you can. And hopefully if you catch it early, the outlook is more optimistic. So we generally have to combine our treatment. Say, for example, for autoimmune disease, you would need a rheumatologist to come in. you need infection disease specialists to come in addition to the pediatric cardiologist that I said makes the pillar of the team. In general, what we do is to find out very early in the disease how high the pressure is, because it tells us the urgency of treating it, but also whether the child responds to certain treatments. So at the time that we as doctors are testing to see how high the pressures are, generally it involves what we call a cardiac catheterization, where we directly push a pressure monitor into the arteries of the pulmonary vessels and then measure the pressures directly. That allows our cardiologists then to give certain medications while the child is asleep, measure the drop of the pressure, and see that this is the preferred medication to use. That forms the mainstay of our treatment, because being a rare disease, nobody really knows so much about it. So we have to develop guidelines based on the experience of people in the States and China, in Australia, and us in South Africa, so that based on that initial test, we tap onto the guidelines and say we start this child on this medication and that medication, but always knowing that we are going to get some response, never 100% unfortunately, but it at least allows us to start on a path which is recognized and which has been tried in many other places.
And I'm sure over time the treatment then evolves and changes.
Very much so, very much so. The medication and treatment plans become much more complicated because the response to the first-line medication is never 100%. You often find that with time you need to introduce new and more complicated treatments, which start to have more side effects perhaps less well-established medications, and therefore more expensive. It's one of those diseases that is very frustrating to treat. But I think that if I compare to the time when I started being a doctor to now, there's certainly a more hopeful outlook now. Yes.
You make mention throughout the whole interview that catching this disease at a very young age, or it affects children, especially the pediatric word has been used quite a bit. When we look at this disease itself, so are those people that are out of their teens into adulthood safe, or is this a disease that can affect people when in their later stages of life?
Yes. It's predominantly, I'm very biased here, because I'm a baby doctor, but it does affect children a lot. But it also affects young adults. And these have been in the media quite a lot recently. I mean, your organization has done a lot to improve the spread of the word of pulmonary hypertension. But it does affect people of all ages. Very rare in the older people. If it does happen in older people, then it's really the consequence of having been diabetic or perhaps having had clots in the lungs, consequence of smoking and other lifestyle issues. But for young adults, it's mostly autoimmune disease. And it's also that group where we say we haven't found anything. But we continue to treat them as if we can.
When you make mention, or when we look at pulmonary hypertension, we're saying it affects children. So when we look at this disease, when we were talking about the genetics of this disease, does it affect everyone across the board, number one? And number two is, when we look at South Africa itself, what has been the symptoms or signs that this disease, is it on an increase in South Africa? Has it reached a state where it is stable? Do we know the facts and figures of South Africans that are affected by pulmonary hypertension?
Yes. Pulmonary hypertension is sort of an equal opportunity disease. It affects everybody of every race. It does, of course, favor the children and the young adults. But we find it across all parts of the world. And what we do know is that there are certain genetic mutations that predispose you to developing PH. And this is why we will see in certain families, for example, where siblings can be affected. We were talking earlier on about a family that we are looking after, where 3 siblings have been affected. That is exceedingly rare, and it suggests again that there must be some genetic abnormality that is causing this. For the vast majority of our patients, we are unable to pinpoint a genetic defect, except in the sense where pulmonary hypertension is secondary, for example, to autoimmune diseases, which we know very well run in families. It's also the kind of condition we are learning more and more about. And this is the kind of approach to a rare disease that has given us actually a very good example to do with other rare diseases. What has happened is that there's been a huge amount of advocacy developed by patients, by parents and relatives and concerned citizens. Here I must praise you, of course, and the whole South African pulmonary hypertension group, who have all come together and said we need to publicize the disease, we need to support research, we need to support families that are affected, and we also need to spread it to doctors and nurses who are at the forefront of diagnosing the disease. So it's a condition where there's been worldwide, really, a combination of national societies which have come together now to develop guidelines as to the treatment. This has, I think, resulted in more diagnosis being made. So it's not a disease that is increasing in frequency, it's just that we recognize it better now.
And when we talk about people or the disease being recognized better, we know as a country, as a human being, sometimes we're not acceptable to change. So when we see young children with such a disease, or we hear the word pulmonary hypertension, when we look at the psychosocial impact that it has on a patient, do you want to take us briefly through that?
Yes. It's very difficult for anybody to face an incurable disease, a disease that debilitates you, that reduces your ability to play, to attend normal school. And it's also very frustrating, I think, when one looks at the eventual outcome of the disease, and particularly for families who have been through it with one sibling. It therefore becomes a disease that has huge impact on the family, on society. And this is where I think societies that sort of come together to support families are really vital. It's an expensive disease to treat because the medications are really expensive. The testing you have to do, the repeated follow-ups with your doctors, all of those things create a huge challenge for a family. And since the disease only affects your ability to exercise and move and leaves you intact in every way, in fact, almost all my patients have been exceptionally clever, boys and girls, witty, and who lead a normal life, except that they can't exercise and move. So it's a disease that is frustrating for our patients because they are full of understanding of what it means. And also there's very little hope we can offer them at the moment beyond trying each medication as it goes. Eventually, some of our patients require a lung transplant, which I'm sure our viewers will recognize is really a very serious undertaking. We do have one patient who, please God, will do well with a lung transplant that is being planned for that patient. And we wish her well. We wish her well. But it's a huge psychosocial problem. And I must say that I'm truly thankful that the patients we have been involved with have turned out to be a source of comfort for other patients who are suffering from similar conditions. And that is a very heartwarming story to tell.
I mean, the support from others plays a pivotal role in helping somebody going through this disease. Dr. Steve, 2 minutes to end, very briefly, any advice to the viewers of ITV when it comes to pulmonary hypertension or the awareness aspect of it?
Pulmonary hypertension is a rare disease, as we've said, but where, as a parent, as members of the community, as doctors and nurses, we should be aware of it, because the earlier we diagnose it, the better the outcome for our patients. It's also very important, I think, for our patients when they go to see their doctor, keep it in mind, talk to your doctor. I always say this to all the patients I see, speak to your doctor and ask about this.
Generally, they only talk about the bill, but...
yes, of course, that's because perhaps as doctors we concentrate on that too. But speak to your doctor, ask questions. If you are not happy with the response, remember most things in children are treatable and they get better within a short time. Something that doesn't get better involves tiredness, fatigue, cardiac failure. Please ask about pulmonary hypertension. Yes.
Dr. Steve Ponde, I'm sure you have painted a good picture enough for our viewers out there to identify this disease from an early age if their children are going through it. We thank you so much for your invaluable information when it comes to pulmonary hypertension, and we wish you the best for the future as well.
Thank you so much.
No problem.
Thank you.
That was Dr. Steve Ponde, and we're talking pulmonary hypertension. As we know, November is Pulmonary Hypertension Awareness Month, and this is our awareness that we are doing here on ITV on Vantage Point this evening to create awareness of this very rare disease. When it comes to any disease, any sickness, we know the cure and shifa is in the hands of the Creator at all times, and that we should be turning to the Creator at all times. Yes, there is the medical aspect of it. We treat it medically. We have to treat it medically because we have been informed that we should be tying our camel first and then asking or making a dua to our Creator. So this is what we do. We treat it medically, but then we also join with that. We turn to our Creator and we ask Allah subhanahu wa ta'ala to grant shifa and cure to all the sick and the weak people that are out there, and inshallah Allah subhanahu wa ta'ala grant them full shifa, a speedy recovery and full strength. You've been watching Vantage Point this evening here on ITV Networks. From myself and the rest of the Vantage Point team, fi amanillah. Assalamu alaikum wa rahmatullahi wa barakatuh.